as we mentioned now before the break, there is treatment options for breast cancer, and they're continuing to advance. And part of that includes tailoring specific treatment to individual patients. We continue my conversation now with Dr. Girdhar. And can you share more about targeted methods of chemotherapy? I've heard that that's something that you're looking at now. Instead of chemotherapy in general, it's more specific.
Oh yeah, Robin, that's another really exciting area of development. These are what we call antibody drug conjugates. So the idea is that there's an antibody that's trained to recognize a specific target that's there on cancer cells. That antibody is the homing beacon to go and find the cancer cell, and it's linked to a few small compounds of chemo. So once it gets taken inside the cancer cell, that's where that chemo payload then gets delivered.
Wow, that's really exciting. I know it's probably off topic, but I know years and years ago, my aunt had esophageal cancer, and they had something, I think it was called electrodynamic therapy, where you had to be in a dark, isolated room, injected with a drug, then light was brought into the body to go where that drug was, and that drug was a cancer-seeking drug, and that's how it was treated. Is that kind of something similar?
Yeah, that premise of trying to give targeted delivery of treatment, absolutely. We have very different modalities to try to achieve that same goal.
So let's talk about treating patients once they've had any type of treatment with a breast cancer diagnosis. How do you treat them with regards to side effects?
Oh, that's a critical part of our skill repertoire, I'd say, is helping support patients through what's already a challenging time, a very life-disrupting time. Mm-hmm. And for us, we work in teams and very much view this as an all-hands-on-deck situation. So our nurses are the fantastic front door to help patients in seeing virtually or in person what side effects can we manage. We work with our pharmacists, and we even have integrative oncology team members that we can work together to help manage, to try to help manage side effects. And this is another area where I think Mayo Clinic's doing a lot of fantastic research. One of my colleagues recently looked and explored if receiving a rose geranium in sesame seed oil can help decrease having nose symptoms, nasal symptoms with chemo, and they just found a study showing success on that front. So I'm really appreciative that we have folks working hard to figure out how can we manage side effects to support patients along their cancer journey.
Because that can be, as we said earlier, it can be just as challenging and difficult as the cancer diagnosis itself. Are we seeing more successes? Are we seeing breast cancer somewhat being beaten?
Absolutely, we're seeing more successes. We're seeing people live longer. We're seeing more effective therapies come along. I'm always cautious about, I hope we get to a spot where we're continuing to detect earlier and earlier and that we can say breast cancer gets beaten, but right now we're making tremendous advances in the field.
So let's talk about the symptoms. We talked about the side effects. We talked about the cancer itself. You kind of are in a place now where you're looking at the entire patient, their previous medical history, their current health, their current lifestyle situation. Let's talk a little bit more about that.
Yeah, absolutely. As we come up with the right treatment plan, we really need to have an excellent understanding of somebody's overall health. We also need to make sure we align properly with goals and values and understand what's happening at home and in life and family to ensure that people can actually get to treatment. How do you manage work and home while getting cancer care? And so those aspects of somebody's life become so important that we get those longitudinal relationships and we get to know our patients really well over time.
Yeah, I think it's interesting when you talk about that because you don't know until you're experiencing it. Like, what do we do with the children when mom goes to get treatment and dad is at work, or, you know, vice versa? So encompassing all of that is such a critical component and so comforting knowing that your medical team can help, you know, direct that for you. What a pleasure. I want to thank Dr. Karthik Girdhar for taking the time to share those insights with us. And tomorrow, we're going to take a closer look at genetic research and precision medicine as we continue our Inside the Fight of Breast Cancer series. And that is the doctor, my apologies, who will have an answer to the question whether or not he thinks cancer will be cured in our lifetime.